we're going to queer up health. States that protect transgender health care now try to absorb demand. States that declared themselves refugees for transgender people have essentially issued an invitation. Get your gender-affirming health care here without fearing prosecution at home. Now that bans on such care for minors are taking effect around the country, Texas could be next, depending on the outcome for a court hearing this week, patients and their families are testing clinics' capacity. Already long waiting lists are growing, yet there are only so many providers of gender-affirming care and only so many patients they can see in a day. For those refuge states, so far California, Connecticut, Colorado, Illinois, Massachusetts, Maryland, Minnesota, New Jersey, New Mexico, Washington, and Vermont, plus Washington, D.C., the question is how to move beyond promises of legal protection and build a network to serve more patients. Dr. Angela Kade Goepferd, medical director of the Gender Health Program at Children's Minnesota Hospital in the Twin Cities, said that the appointment requests are flooding into children's from all over the country, including Texas, Montana, and Florida, all of which have bans. Requests have grown in a year from about 100 a month to 140 to 150. Initial sanctuary laws, or executive orders, were an emergency step to protect transgender people and their families from the threat of prosecution by more than 20 states that have restricted or banned such health care, advocates say. They generally do not contain provisions to shore up health systems, but advocates say that needs to be the next step. So what we're seeing here, of course, is the same thing that we saw happen with abortion, that people are going across state lines, right. And it's only a matter of time probably until these trans bans include bans on crossing state lines for such care. And it also is, I go back to, how can we hate our children so much?
Exactly.
How can we hate our children so much to say we're not going to give them honest care?
Right.
Yeah.
It's just, another thing that's happening. I feel like there's a snowball effect happening. And one state does it, and then another, and then another. I mean, thank goodness for those refuge states that are standing firm on their status. I mean, I have no hope for Florida at this point, but it is disgusting.
Yeah.
My head, when I initially, read this story, I was thinking about abortion, but I was also thinking about immigration. Like I was thinking about sanctuary cities in particular. And if we see the parallels between the states that have stood up for trans kids, for abortion, for immigrant, I mean, they're overlapping, right? So like they're largely the same states. And I do kind of worry about what that's going to mean for some of these states' ability to be able to help across, like how many people can they absorb? Because there is going to be an influx of folks who need care, and they're not being paid for by our taxes. So I mean, so that is, help those states out if you can. Give them money.
And here's a call to those folks who are in medical school or thinking about going to medical school. Consider specializing in gender-affirming care. There aren't enough physicians that do, and we need more of them.
And I'm also a little bit worried because how Republicans say they're about states' rights until they get the majority in the federal government, or they have a trifecta government, and then they start to make these laws national, and there's nothing really we can do at that point.
Right.
They have all three branches of government, including the House and the Senate, and they decide we're going to ban the ability of these states to do this, or we're going to do a national ban on abortion. So goes the states' rights issue, and so that's a thing to worry about in the next few years.
Big one. I mean, and we know the ones who fought the most for the states' rights issue were the former Confederate states, right? Like that, if we can make the parallels, it's not unclear.
We are Queer News Tonight, the world's first and only live daily LGBTQ+ evening news show, brought to you from Happening Out Television Network. We operate in the same model of PBS and NPR, but for the LGBTQ+ community. We educate, inform, and entertain by supporting the 10 pillars of our LGBTQ+ community, with more than 100,000 a week watching us on Roku, Apple Television, and other channels. To keep the story going, we accept donations with 100% transparency. Stay updated and live authentically with Queer News Tonight.